Hello, my name is Shika Gupta and I decided to study arthritis of the hand and wrist for my project. Arthritis is a disease that affects the tissues inside joints. What is a joint? The point at which two or more bones meet. How does it happen? Arthritis can occur as a result of acute or chronic inflammation in a joint and its surrounding soft tissues, which are the tendons, ligaments, muscles, nerves, blood vessels, skin, fat, and synovial membranes that connect, support, or surround other structures and organs of the body. Arthritis can also be caused if there has been distress to the joint, for example, a broken bone, or from environmental or hereditary causes. The major issue in arthritis is that joints wear down in response to the cartilage wearing down. What does the cartilage do? The cartilage cushions the tissue that lines joints. When the cartilage starts to wear down, the structure of the bone begins to alter. As the cartilage corrodes, it eventually affects not only the bones, but also the tendons and ligaments. This process causes the biomechanics of the joint to change, affecting the whole region surrounding the bones and joints. What I'm going to focus on is the upper extremity, specifically arthritis of the hand and wrist. Osteoarthritis is a specific kind of arthritis that I would like to talk about. But let me give you some information about it before I tell you what it exactly is. Healthy joints are able to move easily because of articular cartilage. Osteoarthritis destroys the smooth articular cartilage covering the bones over a period of time. As the cartilage deteriorates, the bare bones rub against each other, resulting in pain, weakness, and stiffness. What is the cause? Osteoarthritis can develop from normal workloads, but also in people who have a family history of arthritis. Osteoarthritis can be an effect caused by traumatic injury, for example, a broken wrist bone or a sprain. Another cause can be Guillain-Barré disease, or when the blood supply to one of the smaller bones of the hand near the wrist, the lunate specifically, is interrupted. When the body's supply of blood is put to a halt, the bone dies, which eventually may lead to osteoarthritis. Symptoms. Symptoms usually include swelling, pain, limited motion, and weakness. These symptoms usually only occur in the wrist joint. I would also like to discuss rheumatoid arthritis. Rheumatoid arthritis is a disease that is autoimmune. And what does that mean? The immune system attacks its own tissues. Rheumatoid arthritis usually affects smaller joints first. It affects both sides of the body symmetrically. In rheumatoid arthritis, the defenses that protect the body from infection instead damage normal tissue, for example, cartilage and ligaments, and they soften the bones. The bones most affected are the radius and ulna. The ulna can soften and erode away, which may tear the tendons that allow you to straighten your fingers. This can cause joint deformities such as bent wrists and fingers. What is the cause? Actually, there really is no answer as to how rheumatoid arthritis developed. Many people have a genetic predisposition, but it is believed that it takes environmental or chemical triggers to activate the disease. Symptoms. Rheumatoid arthritis causes swelling, pain, limited motion, and weakness, and is accompanied by pain, swelling, and stiffness in the knuckle joints of the hand. Doctor examination. How exactly is arthritis diagnosed? Your doctor will systematically record the patient's history, do a physical examination, and carry out several blood tests to diagnose the patient. Blood tests will help reveal whether the individual has rheumatoid arthritis or any blood abnormalities. X-rays will also be taken to view exactly where the damage is occurring. X-rays will also reveal what type of arthritis the patient has. Treatments. Non-surgical treatments. What this aims to do is reduce swelling and pain. Doctors suggest that their patients modify their activities, as in limiting the activities that make the pain worse. For example, a factory worker who has arthritis can no longer carry heavy loads or hefty packages. Immobilization. Keeping the wrists and hands still and protected is essential. Over time, symptoms will reduce. Most of the time, the doctor will give the patient a splint to help with this. Medicine. Usually taking ibuprofen, aspirin, acetaminophen, also known as Tylenol, or any anti-inflammatory medication, does help reduce both the swelling and pain. Exercise. The doctor will usually give the patient specific exercises to do to improve their range of motion in the wrist and hand. Steroid injection. Cortisone, a powerful anti-inflammatory medicine, can be injected into the wrist to reduce the pain and make the hand and wrist less weak. Usually the doctor will recommend that the patient wear a splint and take medication that reduces the pain. But if that is not effective, the doctor will refer the patient to therapy and will also be prescribed to take anti-inflammatory medicine. If this also fails, then we move on to surgical treatments. When there is a progressive loss of hand and wrist function, surgery becomes common. What surgery does is relieve pain and improve the function of the hand and wrist, removing the arthritic bone. In this procedure, approximately 3 carpal or wrist bones are removed. This is called a proximal row corpectomy. This procedure will reduce pain and will allow the wrist to maintain a partial range of motion. Fusion. When the main source of pain happens to be moving the hand and wrist, a few or all of the carpal bones can be fused together to make a single solid bone. The only time when all the bones may be fused is if the patient happens to have severe arthritis. But when this is done, the radius is also fused together with the carpal bones. The only problem is that if this particularly happens, the motion of the wrist will be completely eliminated. Besides that, this procedure aims to reduce pain and allow for some sort of motion in the hand and wrist. Joint replacement. This surgery just removes a damaged joint that replaces it within an artificial device, or also known as prosthesis, which helps the patient improve their wrist movement. Removal of diseased tissue also may take place. In rheumatoid arthritis, tendons and ligaments are commonly affected, and that can be taken care of by tendon transplants from other sites of the body. My experience. For part of my project, I decided to shadow Dr. Sam Viafora, MD, an orthopedic surgeon who specializes in hand, wrist, elbow, and shoulder injuries at Hand to Shoulder Associates. In my time there, I was given the opportunity to view a wide variety of patients with various issues in the upper extremity. Dr. Viafora would discuss the patient's injuries, investigations done, and specific treatments for the patient to help me develop a better understanding of clinical conditions. He shared this training and his school experiences with me and encouraged me to pursue a career in medicine. These are some interesting patients I was given the chance to see. In the first case, the patient underwent wrist fusion to alleviate the pain, swelling, and discomfort, and to prevent further damage occurring from arthritis. Particularly in this case, the patient had a 4-corner wrist fusion to prevent further deterioration from arthritis. The wrist fusion is normally performed by inserting K-wires or pins to keep the carpal bones together and stable. The patient is casted for approximately 6 to 8 weeks to allow for the fusion. X-rays are taken at the end of 6 weeks, and if the fusion has occurred, the pins are removed. Following the fusion, the patients are referred to therapy. In the second case, severe arthritis had disrupted the distal interphalangeal, also known as DIP joints, in the patient's fingers, causing imbalance and deformities at 3 DIP joints. During surgery, the middle and the distal phalanges were aligned in the anatomical position and screws were inserted to maintain the corrected position. In cases like this, the patient is splinted for 6 to 8 weeks, and following removal of the hardware, patient is referred to therapy. The second segment of my project involved shadowing a certain and certified hand therapist, Leslie Friedman. Mrs. Friedman had been practicing hand therapy at Alexian Brothers for more than 20 years. I observed patients with various diagnoses including tendinitis, arthritis, nerve entrapment, conditions like carpal and cubital tunnel syndromes, fractures and post-surgical conditions like carpal and cubital tunnel release, ORIF, open reduction and internal fixation for fractures, tendon repairs, nerve repairs, and artery repairs. It was interesting to observe how very specific protocols were used to treat surgical conditions. Mrs. Friedman used a wide variety of treatment options, including hot and cold packs, soft tissue massage, scar massage and management, wound care, stretching, joint mobilization, active motion, strengthening, splinting, and the use of modalities like ultrasound, electrical stimulation, and iontophoresis to get the best possible outcomes. She was very detail-oriented and customized her treatment based on patients' limitations, needs, lifestyle, work, and hobbies. She fabricated custom splints made out of orthoplast, a combination of rubber and plastic, to position and immobilize affected parts, and added dynamic components to the splint to allow function if necessary. It was very heartwarming to see the special relationship she shared with her patients because she spent a lot of time with them, helped them achieve their goals, and returned them back to their previous level of functioning. Overall, the experiences I gained were very enriching. To me, this wasn't only a school project. Getting so much exposure to the medical world only solidified my desire to pursue a career in the medical field. Thank you for your time.